Quick disclaimer, VETAHEADers. This content represents the opinions of its authors. Content, including the transcript, is presented for discussion purposes and should not be taken as professional or medical advice. No guarantee is given regarding the accuracy of any statements or opinions made here. The transcript, which was prepared with the assistance of artificial intelligence, is provided as a service to our audience. Hello, VETAHEADers. Welcome to another episode of 15 Minutes with Dr. Proença, where I am your host, and together we get ahead with VETAHEAD. I can promise you at least two things. We will have a very good time learning zoo med or exotic animal medicine, and during our journey, you will realize we are more alike than we are different. Medicine is medicine. And if you think a treatment or a procedure doesn't quite sound right if your patient was a dog and not a rabbit, for example, you are probably right. Hello, VETAHEADers. How you doing today? Welcome to another episode of 15 Minutes with Dr. Proença. I'm your host, Dr. Proença, and I'm here today to bring super great information. You know, I always select new papers that are really useful for us in clinical practice, right? That bring information that will actually change the way we do medicine or make us think more critically. No different today, of course. And this is the last one from my rabbit hole deep dive into bearded dragons. This is also a 2024 paper, was published on the American Journal of Veterinary Research, which is available online for free now for us, which is great. And this paper looked into a topic not super happy, but it's part of our clinical lives, right? They looked into the transmucosal administration of pentobarbital and phenytoin, which is the Euthanasia, the euthanasia solution here in the United States for euthanasia in bearded dragons. So giving it transmucosally, or will that lead to a good outcome when it comes to euthanasia, right? This is such a delicate moment that we have with the families and their pets. We definitely want it to go super smooth. We definitely want to be a peaceful experience. And we definitely want to offer our clients the opportunity to be with their pets if they want to. And if they don't want to be with their pets, to know that it was done in a very smooth way without any suffering to the pet. So I think that's why it becomes so important to look into papers like this to see if we have other outcomes, right? Because in reptiles can be tricky sometimes for intravascular access. I know a lot of clinicians decide to do intracardiac injections, which is not wrong, obviously, but I rather not in front of the owner specifically. Can be a little graphic to watch. So often I will do an intravenous or intraosseous route. I know there are intracelomic routes out there described. I do not recommend those. So you're not going to be hearing those from me, although it exists. And again, if you want to do it, it's not necessarily wrong. I just don't think it's the best experience. So the gold standard for euthanasia is intravenous, right? Or intravascular, I should say, for pentobarbital. So this paper looked into alternative methods such as, transmucosal administration, other methods such as, again, intracelomic injections or inhalant anesthetic have been described, but can cause lots of distress and also can be ineffective. So some things in reptiles that can pose unique challenges because of their unique physiology could be the fact that they have cardiovascular shunting, which again can delay drug circulation. They have a slow metabolism, which can prolong drug effects or delay drug effects. And then they have the breath holding and high cerebral hypoxia tolerance, again, making inhalant methods very unreliable. And definitely the environmental contaminations like off the charts there, and I wouldn't recommend it regardless, right? So in this study, they evaluated the transmucosa route, and because it's a potentially non-invasive and IV-free euthanasia method for bearded dragons. So let's see if it actually worked. Oh, and just a little, I know you guys know that already, but some of our listeners might not be as experienced as you guys. We always should keep our reptiles warm before and during euthanasia because of the metabolism. They are ectoderm animals, so they rely on the environmental temperature to regulate their metabolism, right? So we should always keep them warm. So everything can be metabolized as we want it to be. So let's take a look on this study overview. They wanted to see again if the Eutasol transmucosally would be an effective way to induce euthanasia in bearded dragons. They had 6 adult bearded dragons. They had 4 males, 2 females. They were averaging 5 years old, and they were all housed in temperature controlled enclosures between 74 and 76 Fahrenheit. They were fasted overnight before the study. And then they gave the Eutasol, this euthanasia solution, containing the pentobarbital at 39% and phenytoin and sodium at 5%. And they gave in the oral cavity, so transmucosally, using a syringe. Now, guys, please remember this is absorbed through the mucosa, so you need to be wearing gloves. Okay? And if this animals regurge or vomit, whatever, be very careful. Because it can be absorbed. Please be careful. Please be careful. Okay. So the initial dose here, they gave 100 mg per kilo of pentobarbital plus 13 mg per kilo of phenytoin. The second dose they gave, which was 20 minutes later, they gave 400 milligrams per kilo of pentobarbital plus 51 mg per kilo of phenytoin. And then they monitored the lizards until death, and they assessed death by loss of movement, loss of reflexes, loss of pain response, loss of respiration, and loss of heart rate. And then the final confirmation was via Doppler, ultrasound, and ECG. Then they did histopathology on the oral cavity and gastrointestinal tract postmortem to assess for irritation like inflammation or damage, right? So let's take a look at what they found. Are you curious to see the key findings and interpretations of this study? Okay. First of all, that all of us want to know, obviously, the time to death was very prolonged, but was predictable. Okay. Check this out. The median time to death was 300 minutes, 5 hours. Right. It ranged from 300 minutes to 360 minutes, so 5 to 6 hours. The median time to respiratory arrest was 30 minutes, so ranged from 30 to 50 minutes. And the median time to loss of deep pain response was 30 minutes, so ranged from 20 to 50 minutes. It's a lot, right? So they saw that the lizards reached a deeply anesthetized rate approximately 30 minutes after that. The transmucosal, but the cardiac activity persisted for several hours. Again, we do know that it can happen to reptiles. However, you don't want to be doing this on a client-owned animal, right? I mean, I wouldn't want that. And compared to IV and or intracardiac euthanasia, which takes about 45 to 60 minutes, this method for the cardiac activity to end, they bring in this study, this method it's lower, right? So it's faster than previous transmucosal studies in pond turtles. That was 18 hours, the time to death. Again, not necessarily a route that we'll be choosing for client-owned animals. So as I said, it's predictable. We'll end up being effective, but it can be very prolonged. It takes hours to achieve cardiac arrest, which may not be practical in clinical settings when, confirmation of death is needed quickly, right? So when they looked in distress and oral irritation, That was noted in some lizards. So 4 of 6 lizards, so 66.7%, show behavior suggestive of distress immediately after administration. They were lip smacking, heavy breathing, and repeated swallowing. 2 of the 6 lizards, so 33.3%, exhibited whole body spasms, which it can be a little graphic too for owners to see. And oral leakage of the euthanasia solution occur in 4 of 6 lizards, so 66.7% of the cases. And again, guys, that is very dangerous for human safety reasons, right? Pentobarbital has a bitter taste, which might cause this adverse behavior. And the alkaline pH of the Eutasol, which is 11 to 12, might cause caustic irritation. The histopathology showed mild mucosa erosion in one lizard and did raise the concern for potential pain or discomfort, right? When we're doing this IV intravascular, usually we sedate them first, which here you can't because you need them to swallow, I guess, right? Even though it's transmucosal. So, clinical takeaways: transmucosal euthanasia might cause discomfort, should not be used without premedication with sedatives or analgesics, and buffering the euthanasia solution to reduce the alkalinity might help minimize this irritation. Also, some lizards in the study show brief return of pain reflexes. So one lizard lost superficial pain at 10 minutes, but regained it at 20 minutes, then lost it permanently at 30 minutes. Another lizard briefly regained deep pain response at 40 minutes before losing it at 50 minutes, right? So that can be a little creepy there for owners too. Why does it matter clinically, right? Pentobarbital absorption via mucous membrane might be inconsistent, leading to temporary fluctuations in anesthesia depth and may indicate incomplete absorption or delay CNS depression. So we did need to be assessing this often and repeatedly to confirm loss of sensation. And again, pre-medication will with an anesthetic and pain medication, could prevent that. Some clinical takeaways here. I guess we kind of discussed them already, but transmucosal pentobarbital or euthanasia solution is effective but super slow. Death will occur between 5 and 6 hours, requiring prolonged monitoring. It's faster than previous reptile studies, but slow with transmucosal, but it's slower than IV or intrathalamic methods. There are distress behaviors that suggest discomfort prior to loss of consciousness, which is definitely something we do not want on these patients. Or irritation and whole body spasms were observed in some lizards. And histopathology confirmed mild mucosal damage in one case, and it was just one. But again, the number of patients here was already very low. Pre-medication is necessary to prevent the stress in these cases, as we should be doing, at least, even with using intravascular. And this method is not practical for companion animals, right? Without modifications, because owners, of course, expect euthanasia to be rapid and peaceful. So again, faster acting methods, like I told you guys, intravascular, it's what I will definitely recommend. So again, I also, and this is coming from me, I also, after euthanasia, will pit these animals, reptiles. I don't do it in front of the owner. I know there's some controversy too around that topic, but of course, the patients are already confirmed that when I do it, right? And as I told you guys, I usually use the intravascular route, and I heavily sedate them prior to giving the Eutasol intravascular. So let me know what you are doing. Let me know your thoughts. Okay, you can let me know your thoughts on social media. You can follow us at VETAHEAD on social media, especially Instagram. Also the VETAHEAD pod, and of course, you can rate and subscribe to any of the streaming that you're using for this video cast or podcast. Let me know what you think. Thank you so much for being here, and I can't wait to see you or talk to you on the next episode.
Hello, welcome. I'm Dr. Laila Proença,
And I'm Dr. Miranda Sadar.
and we are hoping to give you the tools and confidence to incorporating rabbits in your practice.
Some subjects that we're going to cover include the basics like husbandry, physical examination, and diet recommendations. We'll also cover diseases by subject or kind of anatomical area, also some emergency that you may see. Additionally, we're going to talk about basic surgical procedures, endotracheal intubation, among other topics.
We hope you enjoy. I'm Dr. Laila Proença,
And I'm Dr. Miranda Sadar.
and this is how we think ahead.